Hi guys, today we are going to review some important points of antihypertensive drugs. First, the common suffixes. Here is the common suffixes of antihypertensive drugs. Try to remember those guys so it will be easy in your exam.
I'm going to add something into this slide. Here ACEI means angiotensin converting enzyme inhibitors. I will give you some examples: benazepril, sofenopril, captopril and enalapril. In Sri Lanka we mainly use captopril and enalapril in clinical use. The second one, ARBs. What are ARBs? Angiotensin receptor blockers, mainly angiotensin 2 receptor blocker. Examples: losartan, valsartan, candesartan and fimosartan. The third one, Anjula here gave us CCBs as the suffix as dipines, but you already know the class 1A CCBs are the dipines. So examples: nifedipine, nimodipine, nitrodipine, like that. The fourth one is beta blockers. Examples: atenolol, bisoprolol, metoprolol, propranolol, like that. The fifth one, alpha 1 blockers. What are alpha 1 blockers? Alpha 1 adrenergic receptor blockers are called alpha 1 blockers. We can find them in vascular smooth muscle cells. So what do? When we give some drugs to block the alpha 1 receptor in smooth muscle cells, they cause vasodilation. So eventually hypertension is reduced. So examples: doxazosine, terazosin, silodosin and processine. In Sri Lanka, processine is very famous in clinical practice. And guys, when you are going to do electives or clinical practices in Sri Lanka, just try to read medication lists in patients in medical boards. Then you will be very familiar with the drugs. And the last one is diuretics. Here it is the suffix is he give mide, but the loop diuretics are mainly the mides, not the thiazide diuretics. So examples: furosemide, torsemide, like that. What do? They do inhibit the body's ability to reabsorb sodium in the ascending loops of nephron. So eventually reduce the blood volume and reduce the blood pressure. Okay, let's continue.
Next, the cardioselective beta blockers. Guys, use this mnemonic to remember those. Okay, let's move to the next slide. The effects of the beta blockers. Here also guys, you can use this mnemonic to memorize those. There are about 10 effects. And next, the calcium channel blocker users. There are 6 users. And next, the side effects of ACBs. You can use the word captopril to remember those. And guys, there's a one exception in ARBs. There's no cough in ARBs. And the diuretics. So you can use ET is fabulous to remember the names of the diuretics. And you can use the word he to remember the uses, and hypo to remember the side effects. Okay, let's move to the next slide. MCQ points. This is very important, guys. The last 2 points appeared in the last time exam. And finally, the clinical correlates.
Okay, so thank you very much for watching this video. As you know, this video is done by Anjula. So thank you very much, Anjula. And we will be back to you soon with little bit more attractive sessions in the near future. Keep in touch. Thank you.